The Valley's new isolation and quarantine complex there at Cashman Center will start taking in new patients. It is designed to help the county's most vulnerable fight COVID-19. And 13 Action News reporter Kelsey McFarland now shows you what the operations will look like inside the new shelter.
The medical director for what they're now calling the ISOQ facility says this is the first of its kind in this country. Built from the ground up, it's meant to hold and isolate up to 500 homeless people. These facilities in the parking lot of the Cashman Center are designed as a preemptive medical care facility for our region's homeless.
This particular site is actually the first of its kind in the country. This is a pre-hospital acute observation site versus most of the other field hospitals around the country are actually overflow hospitals from the actual hospital itself.
Tents are separated by patient status to avoid cross-contamination. In the green tent, patients who don't have symptoms but have been exposed to COVID-19. In the yellow tent, patients who are symptomatic but haven't tested positive for the virus.
Someone could be in quarantine, develop symptoms, and then need to be moved here.
In the red tent,
This unit is for the ISO confirmed.
patients who test positive for COVID-19. On site, there are mobile showers, bathrooms, and other medical supplies. Medical personnel and volunteers will staff the tents. They're tasked with identifying and supporting the most vulnerable patients.
This is one of our primary concerns. This is an at-risk, vulnerable patient population. We're trying to give the best support possible to try and ensure that these patients are not out dying on the streets and that we're able to identify them, give them the help that they need, and then ensure that if need be, that they have access to definitive medical care.
Patients in need of care at the ISOQ complex will be transported by ambulance and need a referral from an area medical provider or the Southern Nevada Health District. If a person becomes seriously ill or needs a ventilator, they'll be transferred for hospital care. Security is on site to ensure no visitors go on site. And you may be wondering why these facilities are in the parking lot rather than in the Cashman Field facility. They say they are holding that in case they need it for a pop-up overflow hospital for the general public. I'm Kelsey McFarland, 13 Action News.